Hello dear students, we will now see the diuretics. As this diuretics can be considered as one part of the classification given as per the antihypertensives, but here we are dealing here with different subtopics. So here is diuretics. In this we will see the chemistry of these diuretics, different classes, and what is the basic mechanism metabolism of drug molecules. So first class is carbonic anhydrase inhibitors. We will see now what is this carbonic anhydrase inhibitors. Let's start with the SAR studies of these carbonic anhydrase inhibitors. SAR studies involving the simple heterocyclic sulfonamides, LH prototypic calcium anhydrase inhibitors, for example acetazolamide. The sulfonyl group is essential for in vitro carbonic anhydrase inhibition activity and for diuretics production in vivo. The sulfonyl nitrogen atom must remain unsubstituted to retain both in vivo and in vitro activities. This picture explains why all antibacterial sulfonamides except the sulfanilamide are capable of inhibiting the carbonic anhydrase or exerting diuresis. So here in this structural activity relationship we basically talk about the sulfonamide group which is associated with the heterocyclic molecule, and the role of the sulfonamide group is essential for the development of other drugs in the series. The prototypic molecule considered here is acetazolamide, which is having a sulfonamide group, and this particular group is known as a sulfamoyl group, which is essential for carbonic anhydrase activity, inhibition activity. Likewise, if we consider this sulfonamide group, it is also exerting the antibacterial activity, and in somewhat basis it is also exerting the diuresis activity. In contrast to substitution of methyl group on one of the acetazolamide ring, nitrogenils the uh, methazolamide, a product that retains the carbonic anhydrase inhibition activity. Now here on acetazolamide, if we add or if we substitute a methyl group, then the compound generates is a methazolamide, and it also has the similar activity as that of acetazolamide, the moiety to which the sulfonyl group is attached and must possess the aromatic character. So sulfonyl group should attach with a moiety that has aromatic character. We are basically talking about the heterocyclic molecules which attach to these rings and that provides the aromaticity for the uh, receptor interactions. In addition, within a given series of heterocyclic sulfonamides, the derivative with the highest lipid water partition coefficients and the lowest pK values have a greater carbonic anhydrase inhibition and diuretic activity. If we have a heterocyclic molecule attached to a sulfonyl group, it will generate highest lipid water partition coefficient, as most of these heterocyclic molecules are considered as lipophilic, but because of availability of any elements that has a polarity, because of that reason they have a lowest pK values also. So these are the important features for the carbonic anhydrase inhibition and diuretic activity. The SAR studies involving the meta-disulfamyl benzene, and which is a basic parent molecule of the 1,3 disulfamyl benzene, which lacks the diuretic activity. But if we try to substitute the 1,3-disulfamyl benzene with proper substitution, it will produce a compound that has the greatest diuretic activity. So the first commercially available analog is dichlorphenamide, which is similar to acetazolamide, and it is having carbonic anhydrase inhibition activity, but it is also a chlorouritic agent. Subsequently, chloraminophenamide, when given intravenously, it shows less carbonic anhydrase inhibiting activity, but more chlorouritic activity. Uh, Poor diuretic activity following the oral administration of chloraminophenamide precluded its marketing. Therefore, these drugs are very limited for their use in the market because of some other side effects related to the substitutions attached to the basic molecule. So here we comes about this. This is now our prototype molecule of sulfanilamide. What we have doing here, we have to substitute this particular sulfanilamide with different type of substitution, and we talk about meta disulfamyl benzene. Here the substitution, as here it is shown here, four different substitution at four different places, but there is another type of development that relates to the heterocyclic sulfonamide. That is, instead of this simple aromatic ring, they have now substitute this with heterocyclic molecules, so it will generate acetazolamide and methazolamide. These two have similar properties as that of a meta-disulfamyl benzenes, and shows highest carbonic anhydrase inhibiting activity. Let us see what different substitution we can use as per the SAR points of this meta-disulfamyl benzene. Now here it shows us. So the middle benzene ring here, it shows the different four types of substitutions. As you can see here, the maximum diuretic activity is observed when the position is substituted. Now here they are halogens and one more nitro group. So they basically have electron withdrawing group or a good leaving group attached to this position here on this side. There is another sulfamyl group, and unsubstituted sulfamyl moiety is of paramount importance, as we have to see the interactions of the basic metadisulfamyl benzene with the receptor there. Therefore we need one unsubstituted sulfamyl moiety for the greater interaction. Another substitution with an amino group increases cellulitic activity, but decreases carbonic anhydrase inhibition activity, as the amino group is important for the interaction with the lipophilic receptors, and as this NH2 is having a greater affinity for the hydrophilic pocket, so it is considered for the decrease in carbonic anhydrase inhibition activity. Another sulfamyl group which can be considered as a second moiety with respect to your first unsubstituted moiety. Now this sulfamyl moiety can be replaced with a similar electrophilic group. Example here, it is given as carboxyl carbamoyl, and that may increase the diuretic activity while decreasing the carbonic anhydrase inhibition activity. But here we will need a single unsubstituted sulfamyl moiety and one completely replaced sulfamyl moiety for the good inhibition of this activity. With respect to all these four, they have considered and they have derived two moieties as we have seen in the description part. It is a dichlorophenamide. Here they have substituted with 2-chloro group, and they remains kept the unsubstituted sulfamoyl moiety. Here dichlorophenamide. Another moiety they have derived as a chloroaminophenamide, and this one they have kept one chloro as it is. They have kept one amino group as it is, and they have kept both the sulfamoyl moiety as unsubstituted moiety. So this is how the two different classes of carbonic anhydrase inhibitors they are developed. They are rationally developed from the meta-disulfamyl benzene. This is how the receptor interactions are important here. If we consider now here, this is simple carboxylic acid group can be considered for the interaction with the carbonic anhydrase. Now this is a receptor. It shows the receptor, and this is a molecule that is interacting with the receptor amino acids. Now this carboxylic acid carbonyl group can interact with any amine which is free amine, and that can interact properly. Similarly, if we consider the nitrogen, another amino acid, that carboxylic acid group also interact, one of the proton of the carboxylic acid interact with the amines, and there is a water molecule here. It shows interaction with free carboxylic acid moiety of amino acid. So this is a carbonic anhydrase receptor interactions. But what will happen if we consider a sulfamoyl moiety instead of carboxylic acid? Now the sulfamoyl moiety, it has two S sulfoxide, S double bond O, two sulfoxide, and these two sulfoxides they can easily interact properly with the carbonic anhydrase inhibition activity, as similar to your carboxylic acid. The S double bond O, the sulfoxide, can interact with the free amino acid, nitrogen containing amino acid. Another sulfamoyl moiety NH, and the proton of the sulfamoyl group, it can also interact here as similar to carboxylic acid. It is interacting with the amino acid nitrogen residue. And now here, if we consider the water molecule, instead of water molecule, now here we have another sulfoxide of the sulfamoyl, which can interact with the carbonic anhydrase. So it is quite similar to see this carboxylic acid and sulfamoyl moiety, they can interacting with the carbonic anhydrase receptor. Therefore it is always to consider for the development of series of compounds of these carbonic anhydrase inhibitors, we need to develop the sulfamoyl moiety. Therefore the sulfamoyl moiety is important for the interaction of this carbonic anhydrase inhibition. This is sulfanilamide, as this is the antibacterial activity, and after the introduction of the bacterial infection, it will produce, it was observed, it produces a mild diuresis that can be considered because of some effects on the kidney. It was also shown that it also induces these effects through the inhibition of renal carbonic anhydrase. But these inhibitions were somewhat weak and has the severe side effect. Therefore this is one more reason that we can use this sulfanilamide as one of the important functional part for the development of meta-disulfamyl benzene. What is the precautions that considered for the development of this the sulfanilamide moiety here to improve the carbonic anhydrase inhibition property? Sulfanilamide may be considered as a sulfomyl, that is SO2NH2. Instead of using the full moiety, we can use a single molecule, a single functional group, that is sulfamoyl, and we can try to synthesize the molecule with the sulfonyl moiety, and we can go for the screening of diuretic activity. And with the development of these type of compounds, we can actually see their ability to inhibit the carbonic anhydrase. So based on that development, two chemical classes of these carbonic anhydrase, they can be merged. And the first group is considered as a simple heterocyclic sulfonamides, and the second chemical class here, metadisulfamyl benzene derivatives. These two chemical classes, they are considered for the development of two series of the carbonic anhydrase inhibitors. So basically, if we consider a sulfanilamide, and from the development of this sulfanilamide, we have developed two different classes of the drugs. They are derived like the first molecule derived as a prototype molecule is considered as acetazolamide, and the second molecule, we have only a methyl substitution of one of the nitrogens of thiodiazoe, and it will be methazolamide. Both are having a comparatively good carbonic anhydrase inhibition activity. A small summary of these SCR with respect to your acetazolamide here. Now this is acetazolamide. We have a sulfomoil, we have a heterocyclic molecule, we have now you consider this is a carbomoil moiety. Now carbomoil moiety is NHCOCH3. Sulfomoil group is essential for the production of diuresis, as we have already seen earlier that what is the importance of the sulfomoil group. The sulfomoil nitrogen atom must remain unsubstituted. Nitrogen must remain unsubstituted for the better carbonic anhydrase inhibition activity. The derivative with the highest lipid water partition coefficient and lower pK have a greater carbonic anhydrase inhibition activity and diuretic activity. As we have seen, one of the sulfomoil group is replaced, and we use generally carboxylic acid or carbomoil moieties for the replacement. And this replacement is good. It produces highest lipid water partition coefficient, and because of some polarities available with this acetazolamide side chain, it has a greatest carbonic inhibition activity and diuresis activity. The first molecule we consider here methazolamide, apart from the prototypic molecule, as this methazolamide is a more potent carbonic anhydrase inhibitor than acetazolamide, and it is very rarely used as a diuretic. Instead, it is used for the treatment of glaucoma, as it displays the improved penetration in the eye. Acetazolamide, as we have seen these prototypic molecule, acetazolamide thiodiazole derivative was the first of the carbonic anhydrase inhibitor that is introduced, has the oral effectiveness as a diuresis and a therapeutic effect that lasts from 8 to 12 hours. As mentioned earlier, its diuretic action is limited because of systemic acidosis. The dose of acetazolamide is 250 mg to 1 gram per day. Basically, it is as per the prophylaxis of disease. Methazolamide is a close structural analog of acetazolamide, in which one of the active hydrogens of thiodiazole ring here, it is replaced with a methyl group. The decreases the polarity of the compound, permits the greater penetration into the ocular fluid, where it acts as a carbonic anhydrase inhibitor, reducing the intraocular pressure. The dose of these drug as in glaucoma is 50 to 100 mg, 2 to 3 times a day, as it is available in the drop form. Next class of this diuretic is a type 2 diuretics, also known as high selling or loop diuretics. As we all know, this basic structure of how the urine is produced, and this is the loop diuretics works here. This is known as a loop of Henle, ascending loop of Henle. It works here. This is how it works here. It inhibits the sodium potassium chloride co-transporters loop diuretics by enhancing the sodium delivery, which results in the potassium loss in the collecting drugs. It produces 25% of filtered sodium, which is normally reabsorbed in the loop of Henle. So basically, if we consider loop diuretics, it is useful for the loss of sodium and water. It is for the hypokalemic metabolic alkalosis, and it produces increased calcium loss. So site 2 diuretics, high selling or loop diuretics. These drugs produces a peak diuresis much greater than that of observed with other commonly used diuretics such as high selling diuretics. Therefore, they have given name as high selling diuretics. These diuretics that belongs to the chemical classes. These chemical classes are like organomercurial diuretics. As these organomercurial diuretics, they are not considered as a prime target, or they are not primarily drugs now because of their toxicities. The next class is a 5-sulfoamyl 2-aminobenzoic acid and 5-sulfoamyl 3-aminobenzoic acid derivatives. Examples are furosemide and bumetanide respectively. The third and important class is a phenoxyacetic acid derivatives. Example is ethacrylic acid. So this is how they have classified in 3 different classes. We have only consider here 2 classes here: 5-sulfoamyl 2 and 3 amino acid derivatives and phenoxyacetic acid derivatives. As we consider the chemical classes 5-sulfoamyl 2 and 3 amino benzoic acid derivatives. Some of the uses they have given here uses edema. It is used for the hypertension, for the treatment of hyperkaluria, that is an elevated urinary concentration of calcium are prone to the formation of calcium containing stones within the urinary tract. As we have considered this 5-sulfoamyl 2 means on the second position, that is 2 amino acid, or it can be a 3 amino benzoic acid. So we consider this 2 amino benzoic acid or 3 amino benzoic acid. SAR of 5-sulfoamyl 2 and 3 amino benzoic acid. The substitution at position 1 must be acidic. It should be considered as a carboxylic acid, as the carboxylic acid group which provides the optimal diuretic activity. But other groups such as the tetrazole may have a respectable diuretic activity. A sulfoamyl group in the first position is essential for optimal high selling diuretic activity. Then the activating group, that is X, at 4th position here on this 4th position, it can be chloride trifluoromethyl or phenoxyalkoxy aniline benzyl or benzoyl group. They are considered at 4th position. And now let us see 5-sulfoamyl 2 amino benzoic acid. All the substitution can be tolerated on 2 amino groups and are limited. No deviations are allowed to on the few moieties that are acceptable. We consider on the second position we have always have amine, but one of the proton of these amine is substituted. Let us consider R here. R will be furfuryl benzyl or thiamethyl. They have given here as then it is given for the decreasing order for the diuretic activity, as this is furfuryl. If we add this furfuryl, it will be furosemide, and it is a Lasix. It is for the increase in diuresis. Then benzyl they have not considered because there is no such compound with the benzyl. And the last one is thiamethyl. As thiamethyl also they have not considered, as it does not have a kind of compound which is present here. But we have only furfuryl containing compound, that is furosemide, and from furosemide they have developed a new type of series of compound, azosemide, and in case of azosemide, the only difference furosemide and azosemide is having, instead of carboxylic acid at the first position, they have tetrazole, and that tetrazole is a kind of highly it is providing a polarity to for the receptor interaction, azosemide. Then 5-sulfoamyl 3-amino benzoic acid. On the third position we have nitrogen, and all the possibility of substitution of R, because we consider these are, it can be a wide range of different alkyl groups, or it might be aromatic or heterocyclic groups also. If we consider R here, R is a butyl, then they have developed this series of the compound known as a bumetanide. Now bumetanide is also important diuretic drug here. If we consider there is a cyclization of this nitrogen, third nitrogen, it produces a compound known as a pyrantinide. Here we will see now furosemide, as some of the important points we have already considered for the SAR, but let us see about the SAR of furosemide, as furosemide is the example of high selling diuretic and may be regarded as a derivative of anthenolic acid or orthoaminobenzoic acid. Research on 5-sulfoamyl anthenolic acid at this laboratory in Germany shows a greater effectiveness as diuretic, and it produces a series of various substituted derivatives of furosemide. In the case of furosemide, we consider the chlorine and the sulfonamide substitution are the features we have already discussed earlier in diuretics. Because of the molecule possessing the free carboxylic acid group, furosemide is having a stronger acid, and if we compare with the thiazide diuretics having a pK of 3.9, the drug is excreted primarily unchanged. A small amount of metabolism, however, can take place on the furan ring, which is substituted on the aromatic amino group. Therefore, we consider the furosemide, it has a diuretic effect as that of thiazide diuretics. It has a shorter duration of action, about approximately 6 to 8 hours. Furosemide can cause excretion of sodium chloride, potassium, calcium, magnesium, and bicarbonate ions. The next drug which is related to your furosemide is bumetanide. Here also we see some of the points related to SAR, as bumetanide is a phenoxy group that is replaced customarily for chloro, or you can see trifluoromethyl substitution with the other diuretic molecules. The phenoxy group is an electron withdrawing group, and it can work similar to your chloro and trifluoromethyl substituent. The amine group can be seen at sixth position, but now here it is moved to the fifth position. These variations can produce activity which is similar to furosemide, but because of some alterations from sixth to fifth position, it shows higher diuretic activity. The shorter duration of action is similar to your compound, but it is almost 50 times more potent than that of furosemide. Replacement of phenoxy group at fourth position with aniline, or it can be considered with sulfonyl benzene. It gives a favorable activity, but when we consider a butyl group at C5, which is attached to nitrogen, it is having a kind of good activity. It provides a good activity. If we try to replace the butyl group with any other furanyl methyl group, like we have seen in the furosemide, the results are not good. It does not shows the effect on diuretic activity. Therapeutic applications here. This compound is functions as a high selling diuretic in the ascending loop of Henle. Its duration of action is approximately 4 hours. The uses of this compound is similar to those of furosemide. Our next drug in the series is ethacranic acid, as ethacranic acid is quite different from the first two compound, that is furosemide and uniquenite. Ethacranic acid is derived as a phenoxyacetic acid derivative, high selling diuretic, and it is the only prototypic drug molecule in the series of this compound. These compounds were developed at about same times of that of furosemide, and having a similar mechanism as that of organomercurials. So organomercurials acts through inhibition of sulfhydryl containing enzymes involved in the solute reabsorption. Therefore, if you consider the mechanism of ethacranic acid, it is much more complex as that of organomercurials. It is quite complex, as it undergoes a simple Michael addition of alpha and beta unsubstituted ketone, as it has a terminal vinyl group, ethacranic acid. Because of that reason, it undergoes some kind of Michael addition at alpha beta unsubstituted ketone. It produces that activity through these sulfhydryl groups, and when the double bond of ethacranic acid is reduced, as we have seen, because of Michael addition, there is a reduction in the double bond of ethacranic acid. It produces a similar kind of as we can see the drug molecule, which is similar activity, but the diuretic activity is somewhat less as compared to the double bond having the ethacranic acid. The sulfhydryl groups of the enzyme would not be expected to add to the drug molecule in the absence of alpha beta unsaturated ketone. Ethacranic acid is only aloof or diuretic, that is not sulfonamide derivative, and may be useful in patients who are allergic to sulfonamides. The pharmacokinetic properties of ethacranic acids is shown. Similar to other high selling diuretics, ethacranic acid also inhibits sodium potassium chloride symphoter and the ascending limb of loop of Henlitz, which is required for the promotion of increase in diuresis. It also enhances the excretion of sodium, chloride, potassium, and calcium through the intravenous administration. Let us see the structural activity relationship of this diuretic. Uh, It is when we consider oxoacetic acid group which is positioned to para. Now here oxoacetic acid group, it is positioned to para to the alpha beta unsaturated carbonyl group, that is other sulfhydryl reactive group. Now this is we consider here, this is sulfhydryl reactive group, as the sulfhydryl molecules can add these across the double bond very much easier. The chloro or methyl groups were placed at 2 or 3 positions of phenyl ring here. In addition, the hydrogen atoms on the terminal alkene carbon also provided the maximum reactivity. Thus, a molecule with a weakly acidic group to direct the drug to the kidney or an alkylating moiety reacts with the sulfhydryl groups, and a lipophilic group seems to provide the best combination for diuretic in this class. Uh, these features lead to the development of ethacrylic acid as a prototypic molecule of this class. As ethacrylic acid is not widely used because of its toxicity effects like ototoxicity and severe gastrointestinal effects if we compare with the furosemide and bumetanide. The other drugs in the series are azoxamide, pyretinide and tramponite. We'll see now what is this phenoxyacetic acid derivative here, as we have already seen the basic things here. The uses are similar to the furosemide and bumetanide, as ethacrylic acid is prescribed for individual drugs who has a known hypersensitivity to sulfonyl containing drugs. Also produces some of the adverse effect that is quite similar, but because of the reason that furosemide and bumetanide are not having the sulfonyl group, it is having somewhat different adverse effect. Also it produces ototoxicity and gastrointestinal effect. Pharmacokinetic of ethacrylic acid, as we have seen the sulfhydryl group can add the across the double bond of the ethacrylic acid, as it is important for the mechanism of action of ethacrylic acid. Therefore here also we have to understand, while addition of the sulfhydryl group across the double bond, what will happen after the addition of that sulfhydryl groups here. And you can see here the ethacrylic acid alkylate the thiol endogenous compound as a glutathione, as RSH is a glutathione here, and it produces sulfhydryl containing conjugates here. It produces sulfhydryl containing conjugates, and that can be converted into ethacrylic acid cysteine and ethacrylic acid and acetylcysteine conjugates, and it is considered as an equilibrium as compared to other drug molecules. Ethacrylic acid cysteine conjugate is quite unstable in vitro and in vivo, that releases ethacrylic acid and cysteine. Similarly, ethacrylic acid glutathione and ethacrylic acid cysteines are equiefficacious diuretic as compared to the prototype molecule that is ethacrylic acid. We have already seen the SAR of the drug molecule, as here it is summarized. The oxyacetic acid moiety is placed at number 1 place on the benzene ring. The sulfhydryl reactive acryl oil moiety is located para to oxyacetic acid group. Activating groups, that is chlorine and methyl, occupy either third position, or it can be considered on the second and third position subsequently. Alkyl substitution of 2 to 4 carbons length can occupy the position of alpha carbonyl on the acryl oil moiety. Hydrogen atoms occupy the terminal position of carbon-carbon double bond across the acryloid moiety. Next class in the series of diuretics is benzothiazine or thiazide diuretic. Now here, if we see this diagram, here on this position, this thiazides works here. Okay, this thiazide diuretics works across the sodium chloride co-transporter, and by just inhibition of this sodium chloride transporter, and it enhances the sodium delivery results and potassium loss in collecting ducts. It increases its 10% of filtered sodium that is normally reabsorbed in the distal convoluted tubule. So why thiazide diuretics specifically useful here is for the loss of sodium in water. It is for hypokalemic metabolic alkalosis and for the increase in calcium reabsorption. Benzothiazine or thiazide diuretics. The mechanism is further study of benzene disulfonamide derivative was undertaken to find out more efficacious carbonic anhydrase inhibitor, and this study provides some of the compounds with a higher degree of diuretic activity. Chloro and amino substitution give compound with an increase in activity, but these compounds are weakly carbonic anhydrase inhibitor. But when we consider the replacement of amino group by just reaction of the amine with acylation, it is unexpected ring closure takes place, and this ring closure, and it produces some compounds with a diuretic activity which is independent of any carbonic anhydrate inhibition activity, and it produces a new series of compound called benzothiazine, and this is the discovery of this benzothiazine. These diuretics are actively secreted in the proximal tubules and are carried to the loop of Henle and to the distal tubule. The major site of action of these compounds is in the distal convoluted tubule, where these drugs compete for the chloride binding site of the sodium and chloride symphyta and inhibit the reabsorption of sodium and chloride ions. For this reason, they are referred as a diuretics, and they also inhibit the reabsorption of potassium and bicarbonate ions, but to a lesser degree. This is how the thiazide and these are developed here. So we have seen this earlier by simple two reactions. Now this sulfonyl benzene is converted here. Here, if you see the first reaction, this is using acylating agent. The ring closure takes place, and it will be cyclized now by cyclized sulfonamide, and at the first position we have a cyclized sulfonyl group, and this series is known as thiazide. On the other side, if we see by using aldehyde and ketone reaction, there is also one series is developed. This series is known as a hydrothiazide. The only difference between thiazide and hydrothiazide is on the third position there is a double bond in thiazide, and here on the hydrothiazide there is no double bond, position from 3 to 4. Structural activity relationship. The position 2 can tolerate small alkyl groups such as a methyl group. Here on this nitrogen there is a substitution of small alkyl groups can be possible. Alkyl substitution on second nitrogen position, and if we try to substitute this, it increases the polarity as well as increases the duration of action for the diuretics. A substitution at third position determines the potency and duration of action of thiazides. Substitution with a lipophilic group at position 3, that will mark increase in diuretic potency. If we substitute at 3 position with haloalkyl, aryalkyl or thioether, the substitution increases the lipophilicity, solubility of the molecule, and it will also increases the duration of action, longer duration of action. Saturation of carbon-carbon double bond from 3 to 4 position, starting from 3 to 4 means on third carbon we have a double bond. If we try to saturate the double bond of 3 to 4 position, it will be benzothiazine 1,1 dioxide nucleus, and this nucleus will increase the potency of this class to 3 to 10 folds. A direct substitution of 4, 5 and 8 position with an alkyl group usually results in the diminished diuretic activity. Then a substitution of 6th position with activating group is essential for diuretic activity. The base substituent include a chlorobromo trifluoromethyl or nitro group. The sulfonyl group in the 7th position is essential for diuretic activity, and we cannot replace the 7th sulfonyl group. An electron withdrawing group is necessary at the 6th position of diuretic activity for the diuretic activity. Little diuretic activity is seen with the hydrogen atom at position 6, whereas the compound with the chloro or trifluoromethyl substitution is having higher activity. The trifluoromethyl substitute diuretics are more lipid soluble and have a longer duration of action than their chloro substituted analogues. When we consider electron releasing groups such as a methyl or a methoxyl in place of in 6th position, diuretic activity is somewhat reduced, so we need some electron withdrawing groups on this position. We'll move to the next, that is thiazide like diuretics. Now here we will consider the thiazide diuretics, means they almost have similar action as that of thiazide, but we have to consider some changes that occurs in the structure. The sulfonyl group para 2 activating group of thiazide could be replaced by several other electronegative groups with the retention of activity that can be amide, carbonyl, carboxyl group, etc. in metadisulfonyl benzene, and these diuretics known as a thiazide like diuretics. Their site of action, efficacy, electrolyte excretion pattern, and adverse effect are almost resembles to thiazide. Here we see thiazide like diuretics, specifically quinazolinone derivative. The mechanism for the thiazide like diuretics is this is a structurally diverse group of sulfonamide and that do not contain benzothiazine ring. Nevertheless, they have same mechanism of action and similar therapeutic activities and adverse effect as that of thiazide diuretics. Specific drugs as the quinazoline derivatives like metolazone and quinatolazone, they are derived from this moiety here, quinazoline 4-one. Now here on this 4th position, instead of sulfonyl we have only carbonyl group, and it will be like a quinazoline ring. The quinazoline 4 own molecule is structurally modified in a manner similar to that of modification of thiazide diuretics. The two drugs, they are almost having pK of 9.7, as we have seen for the thiazide diuretics. The structural differences between quinazolinone is the replacement of 4 sulfone, that is SO2, with 4 keto group, that is a carbonyl group. Because of their similar structures, it is not surprising to see that this quinazolinones, they have a diuretic effect as that of thiazide diuretics. So similar drug molecules for thiazide diuretics is hydroflumethiates. Now here hydroflumethiates, instead of chlorine of metadisulfamyl ring here, we have added trifluoromethyl. This hydrofluomethazide inhibit the sodium chloride synporter and the DCT, which further inhibits the reabsorption of water. Sodium chloride transporter facilitates the entrance of sodium into the epithelial cells in DCT, and therefore the influx of sodium establishes an osmotic gradient which is necessary for water reabsorption. The next molecule is cyclothiazides. It is a benzothiazide. It is similar to thiazide diuretics, and it is also antihypertensive. Cyclothiazide is a positive allosteric modulator of AMPA and kinase receptor, which is capable of reducing, essentially eliminating the rapid desensitization of former receptor and potentiating AMPA mediated glutamate currents. The next class of diuretics is site 4 diuretics, also known as a potassium sparing diuretics. Diuretics that increases the sodium and chloride excretion without a concomitant increase in the urinary excretion rate of potassium. These agents are known as a potassium sparing diuretics, or they may be referred as anti-cholinergic agents. In the classification, we have two different classes. Aldosterone antagonists, examples are spironolactone, and directly acting diuretics, examples are transthyretin and amiloride. Some properties and uses. These agents are not potent diuretics, and when used alone, but in combined with thiazides, they can be shows proper diuretic action. Examples of these are aldactizide. They also reduce the potassium loss, increase sodium excretion, used for minimizes alkalosis. The onset of diuresis with a combination therapy is much more rapid than with spironolactone alone. Therefore, it is always used in a combination with some other diuretics. The first drug in the series of this is aldosterone antagonist, that is spironolactone. As the spironolactone, it is having a steroidal backbone, and on the fourth position of the steroid we have a lactone. Because of that reason, it can be considered a higher lipophilic drug molecule, and it is useful for the treatment of edema. It is also useful for the treatment as an antihypertensive agent. Primarily, it is used in combination with diuretics that act at site 2 or 3 for reduction in a hypokalemic effect that latter groups of diuretics. Similarly, it have some adverse effect like hypokalemia, metabolic acidosis, and because it has a steroidal backbone, it produces some hormonal adverse effect. So, similar to this, we have a minor gastrointestinal symptoms. Aldosterone acts through mineralocorticoid receptor action. As the aldosterone, it goes into the nucleus and it binds to the mineralocorticoid receptor. Furthermore, if it further goes with the so when it combines with the mineralocorticoid receptor, and it acts on the sodium potassium ATPase, and indirectly or directly it acts on mRNA, therefore increasing the mineralocorticoid actions. Therefore, aldosterone is useful for the induction of sodium potassium ATPase and the silk convoluted cells. Aldosterone is the principal mineralocorticoid from the adrenal steroid, and receptor is a member of nuclear hormone receptor family. Metabolism, as spironolactone is metabolized through candidone, which is an active aldosterone antagonist. As you can see here on this position, there is a removal of this S double bond and methyl. With this candidone is an active metabolite of spironolactone. Next molecule in the series is tramterine. It is a pteridine nucleus. This is 2,4,7 triamino 6 phenyl pteridine, and few SR points here respect to this nucleus. Para substitution of phenyl ring, that is hydroxyl group, increases the activity. The phenyl group can be replaced by smaller heterocyclic ring molecule. Here we are talking about this 6 phenyl group. The amino group must be unsubstituted. All the amino groups must be unsubstituted. It has structural similarities to folic acid and certain dihydrofolate reductase inhibitor, as the basic moiety is a pteridine. The pteridines are always acts on the folic acids. Because of that reason, it acts and it reduces the dihydrofolate reductase, but it is quite less as that compared to the main effects. Some of the adverse effects are like hypokalemia, renal stone formation, and some gastrointestinal symptoms. It is used for the treatment of edema and hypertension. Use in combination with other diuretics that acts on 2 and site 2 and site 3 for the treatment and prevention of hypokalemia. Next drug in the series is amiloride. Now here amiloride is from the chemical class pyrazinoyl guanidines. Now the side chain of this amiloride is made up of guanidine. Therefore, this is pyrazinoyl guanidine, and over the 225,000 agents were examined in an attempt to discover an anticholinergic agent without hormonal activity. The optimal diuretic activity is observed when, this is the ICR points of this amiloride. The sixth position is substituted with chlorine. We have a chloride group at sixth position of this amiloride. The amino group at number 3 and number 5 positions. Number 3 and number 5 positions, they must be unsubstituted. Then guanidino nitrogens are not substituted with alkyl groups. They must be unsubstituted as it is considered for their interaction with the receptor. Moderately plasma protein bound and having oral bioavailability of 15 to 20%. It is used in combination with hydrochlorothiazide. The mechanism of action is plugs the sodium channels, preventing electrogenic reabsorption. of 2 to 3% filtered sodium, and it directly blocks the sodium entry through sodium selective ion channels, which directly alters the sodium potassium exchange mechanism in distal nephrons. Therefore, this amiloride is acting as a plugs for the blocking of the sodium channels. Several side effects like hypokalemia, nausea, vomiting, headache, and diarrhea. So this is amiloride. Last class from this diuretic is a osmotic diuretic. Some features are for this osmotic diuretic. They have passively filtered by glomerular filtration. They undergoes limited reabsorption in the renal tubules. They are metabolically and pharmacologically inert. They have higher degree of water solubility. The examples are mannitol and theophylline, as mannitol is one of the, as you can see, a sugar molecule. Sugars are also considered here for the osmotic diuretic. And another example is theophylline. Mannitol, let us consider this mannitol, the prototypic osmotic diuretic. Then D-mannitol is a water soluble. As it is a sugar, then sugars are highly water soluble. Lipid insoluble hexahydroxy alcohol, as we have a lot of hydroxyl group attached over the series of aliphatic chain here. All these are hydroxy groups. They are highly hydrophilic, and they are lipid insoluble. It does not diffuse GIT or renal tubule epithelium. Mannitol should be given by intravenous route. Mannitol enters renal luminal fluid by glomerular filtration. Its high luminal fluid concentration creates an osmotic effect, and that may prevent reabsorption of up to 28% of filtered load of water. Mannitol may be employed prophylactically to avoid acute renal failure or reduction of CSF volume or pressure. Because the solutions of mannitol may expand the extracellular fluid volume, and they should not be used in patients with a severe renal disease and cardiac decomposition. So this is mannitol. It is a prototypic osmotic diuretic, and it is useful